Hi, good morning. It's Dr. Amber with Voitenko Wellness. And I wanted to mention that my clinic, this is Wellness Wednesday. And I wanted to mention that my clinic is in Tustin. I know some of you have actually been watching my Wellness Wednesdays and asking where we're located. So we're in Tustin, California. We are on the main drag of Newport Avenue in Tustin. Anyway, today is Wellness Wednesday. It's July 21st. We're in the middle here of summer, which is exciting. I wanted to bring up a little known condition that I actually did a Facebook Live on, which is the subject of and condition of vertigo. So, just so you guys know, as far as chiropractic goes and vertigo, we are actually trained to do neurological exams and structural exams to identify why somebody is suffering from vertigo. Vertigo is an interesting condition. One thing is for sure, it's the pits. The dizziness, people feel nauseous. Sometimes there's even vomiting involved. It can get as bad so as to you can't even get up. You are literally glued to whatever surface you're on. I've had many individuals literally not be able to get up off the floor or out of their bed due to vertigo. So there's some different conditions in vertigo. There's 4 different types. One of them is due to migraines. Basically, it's something that you start to feel either minutes to hours before suffering from a migraine. So we, at our office help identify what type of vertigo someone is suffering with and then how to treat them. In regards to migraines, a lot of individuals don't know that we actually help people with migraines. So, we look at them both neurologically and structurally. So a lot of times we'll ask for x-ray if we feel that that's the direction we're going as far as a vertigo condition. Also, there is the type of vertigo that one gets as far as symptoms go, where they turn or they look quickly. So they'll say, oh, I rolled over in bed and I felt dizzy, nauseous. I felt like I was spinning or the room is spinning. And so that's a positional type situation. And sometimes it can be as easy as they say they're driving and they look behind them to see, oncoming traffic or if they're changing lanes and they get the vertigo. So again, we identify, what type of vertigo that is. And it's a benign type of vestibular vertigo. There's also, a condition where you can have problems inner ear. And so when that occurs, if there's been infection or if there's actually a situation structurally, we can help identify that as well. And I made my little notes because there's 4 of them. So vestibular neuronitis is actually another condition where an individual has been sick and now they're having the dizziness and the vertigo sensation. So there's migraine, there's whether you've been sick or not with sinus infection, a cold, flu, things like that. And then there's also an actual inner ear problem, Meniere's disease. And then there's the positional benign, you're looking quickly or you're rolling in bed and you get vertigo or you wake up with vertigo. So I know that it's been asked, okay, well, what is it that we do to exactly fix this? Some people will have vertigo. It comes and goes quickly. Other people suffer with vertigo, meaning it comes on. They're dealing with it, hours to days to weeks, and then it goes. Regardless, finding out if there's a structural or neurological situation, chiropractic is very gentle, non-invasive way of handling vertigo issues. And again, when we do our examination, and a lot of times if we ask for x-ray, we can identify what is causing that neurological stress, what can be happening structurally to bring on those symptoms. So, things that you can do at home though, we definitely always are educating our patients on stretching. Now with technology, phones, iPads, the laptops, the computers. Right now, interestingly, we're dealing with ergonomics once again. I bring this up a lot because people are going back into the office. Some might still be working from home and office. Some are going full-time back in the office. So the ergonomics are once again changing. So symptoms are coming about. But the stretching is so important. I mean, one of the main things is making sure, as far as your shoulder muscles, your neck muscles, that you're identifying that tension tightness. If you feel like your neck is getting stuck, it's tight, doing ranges of motion with looking down, looking up, one at a time, looking to the right, looking to the left, doing side bending, doing trap stretches, very, very effective. As well as watching your posture, making sure that, again, your ergonomics are correct at your desk. One thing for the computer, you never really want to be looking down. You want to be looking straight ahead, maybe slightly, mainly straight ahead with the screen. The keyboard, though, you want to be at that 90 degrees, maybe slightly lower. If you're using, your laptop, you want to make sure that you're on a keyboard, maybe even a wireless, so as to be able to bring the screen up in front of you. With your cell phones, it sounds funny, but they make these really neat things where you can, they have sponge, so they're easy on your shoulders, but it actually holds the phone out in front of you. Obviously not walking out in public with that, I understand, but doing it at home so you're not looking down at your phone. I can't tell you how many times I see people looking down, even in the office when they're waiting for their adjustment or they're waiting on the table. They're looking down, rolled shoulders into their cell phone. So that can cause the structural neurological stress that can lead to vertigo. Really watching these things at work, at home, watching your screen time on your phones, very, very important. Now, even, people will tell me, oh my gosh, I Netflix binge. I'll say, oh, what do you watch your Netflix on? They're telling me their iPad, their phone, they're lying in bed with their head flexed, or on the side, and that can cause structural subluxation misalignment. So something to obviously identify and correct. Not wanting to do, making sure that you give yourself a break with screen time. But again, as far as helping, chiropractic is so fantastic in dealing with vertigo problems. And I know people who suffer with vertigo, it's awful. At my clinic, over the last 20 plus years, we've really helped a lot of individuals with vertigo. So hopefully this is a good topic for you guys. This is Wellness Wednesday with Voitenko Wellness. I appreciate you listening. If you have any questions, you can obviously message us. We're there for you. You can message us on Instagram, Facebook. You can also email us at info@voitenkowellness.com. Our number is 714-730-2225. And we'd love to help. Okay, have a great rest of your week. Happy summer.